On this edition of the Best Docs Network featuring Forest Park Medical Center, General Surgeon Dr. Glenn Eide, Bariatric Surgeon Dr. James Davidson, Anesthesiologist Dr. Peter Beck, Plastic Surgeon Dr. David Azuz.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Centers, one of the top medical centers in the entire Dallas-Fort Worth area.
Yes, it is, and this is a whole show dedicated to Forest Park Medical Centers and their fine physicians. Like our first doctor, it's Dr. Peter Beck.
17 years ago, I fell at work. I've had 4 surgeries total, and after that, I've been through massage therapy, I've been through acupuncture, I've been through the deep massage therapy. Nothing seemed to help with the damaged nerves that was there. I've been to doctor after doctor and after doctor, and finally, after years of that, it's like, why go anyplace else? Nobody can help you. There's nothing to help with the pain, so you just take lots of over-the-counter medicines and try to keep going because you still have to work and feed your family. I was introduced to Dr. Beck here at work. He said he had a new product, new technology out that would try to help with chronic pain. And he had heard that I'd had some knee problems and knee pain, and so he wanted to try it and see if it would work for me.
The P-stem was actually a device that has been in Europe since about 2000. And it was FDA approved in the US in 2006. The reality is that there is a lot of skepticism initially with using P-stem, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. Once the device is secured behind the ear, mapping of the ear occurs, where I locate nerve endings on the ear which correlate to areas of pain in the body.
It was a very non-invasive procedure. It used little electrodes that gave little impulses. There was no medication involved where you could still drive and work and those kind of things. Your head was still clear, you weren't foggy with it. It makes your day go a whole lot better.
P-stem is not going to fix her knee, and she will get her surgery to replace her knees. But P-stem has been able to control or manage her pain so that she's able to focus on other things outside of her knee.
After having 17 years of pain and having this very non-invasive P-stem placed and being pain-free and being able to do the things that I want to do with my 10-year-old daughter, the whole world has totally changed for me.
What I find rewarding about P-stem is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Today we're having the Highland Park Science Festival, and they've asked me to come speak specifically about robotic surgery. And I've had the Intuitive people and Forest Park partner together to get 2 demonstration robots so the kids can actually see what we do with a robot and kind of how we get prepared for surgery.
We have 15 students who have opted to come see Dr. Salter and actually get to manipulate this Da Vinci robot. I personally know a lot of these kids, and I've taught them a couple of times. Most of them are seniors, and a lot of them are interested in medicine. So this is, I think, going to be a really inspiring event for them.
The kids have absolutely loved it. They have just been full of questions. They can't wait to get up there and actually get on the machines and feel what it's like to operate the machines. So I think we've got some great minds here, and I think that if they can just be channeled into the right direction, that medicine has a very bright future, and these kids will be part of it.
We are so fortunate that members of the community feel like they need to give back to these kids, and I don't know if they really realize the impact that they have on a lot of students, because this is bringing the actual profession into the classroom. You know, it's a great event, and it's gotten bigger every year.
So much of medicine has been maligned lately, and I'm afraid we're losing our really smart kids going into other professions because of the length of training, the risk of lawsuits, all the negative things that they hear about, and they don't hear any of the positive. So I wanted to make sure the kids know there is a positive to medicine, and that if they like technology and they like to be involved in the newest stuff, this is where it's at with surgery. And we have a great medical center in Forest Park, and they like to get out and help the kids see what's available for our community. And I've always wanted to be able to get out and show the kids what they have available. And Forest Park has always been open-minded about trying new technology, new equipment. They also want to get out and show, you know, people what's available, what they can offer that's different than some of the other hospitals.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients, and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes, to classes on hemodynamics, to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because, as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on, and finding out what is the newest research and articles that are out, so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in the healthcare setting.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients. And working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to
want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just so much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
Erin's a lovely 27-year-old who struggled with her weight pretty much throughout her entire young adult life. And so after lots of different things like diets that exist and diet pills, she was not able to lose weight.
Before I came to see Dr. Kim, I was starting to have some health issues. I had thyroid issues, I was borderline diabetic, and I was ready to do something about that before they became major health issues. I was already starting to take medications that I didn't feel like I should really be on at my age.
Erin and I sat down and chatted about the different options that were available for her. She chose gastric sleeve surgery, and this was a great fit for her because she has a very active life.
What really drew me to this sleeve surgery was that there was no device that would be implanted into my stomach, and it was not as extreme as the gastric bypass.
The operation allowed her to lose a tremendous amount of weight. In a year, she lost almost 100 pounds, and she was able to then have a life that everyone wants to have as a young person.
Once I started seeing the results, I was really motivated to keep going and to keep eating healthy and to keep going to the gym every day, and just mainly the results are what really keeps you going.
Sleeve surgery, though the operation does entail physically reconstructing someone's stomach, what a patient is required to do after surgery would be nothing different than what other people are expected to do, which is to practice portion control as well as wise nutrition choices and trying to get some exercise every day. And when they do these practical steps along with good sleeve surgery, patients can do marvelously well.
When I go shopping, you know, people are actually interested in helping me. The people in the stores now, they're more willing to help me. They pull clothes for me, and shopping is fun. I don't have to go to specialty stores anymore, and I can wear heels. Before I could never wear high heels, and shopping is just a lot of fun for me now.
For those suffering from gastric reflux, Dr. Glenn Idy, who operates right here at Forest Park Medical Center, can certainly help.
Once we've diagnosed reflux and we're sure that we're dealing with that entity, then we can talk about treatment. And a lot of people think that we just skip straight to medications, but in fact, most people initially recommend lifestyle changes.
We tell people maybe elevate the head of your bed to help gravity take effect with the symptoms that may be occurring at night. Avoid eating late at night, eat smaller meals, avoid carbonated beverages, and avoid some of those trigger foods that may relax that lower esophageal sphincter and increase the amount of reflux that can occur. If those don't work, many people will go to over-the-counter medications. They may see their primary care doctor or gastroenterologist, and they may prescribe acid-reducing medications.
As people get reflux more often, they start using medications that actually prevent the production of acid. So the stomach content is less acidic, so when they do reflux, it doesn't burn. If you've been on those medications for more than 8 weeks, or you have to take them every day to prevent symptoms, or even if you're having symptoms while you're taking those medications, then it's time to think about surgery.
Reflux disease is normally a problem with the anatomy at the junction of the stomach and the esophagus. And there's usually a hiatal hernia that can accompany reflux disease patients. And when we go and correct that anatomical defect, you can basically help restore that normal anatomy to where patients do not have to take their medications any longer.
So the newer procedure, what we call a transoral fundoplication, tends to provide the treatment without the complications. So if you're taking the medications for a long period of time, if you're symptomatic on those medications, then now might be the time to think about turning towards a surgical procedure that can recreate the anatomy the way it's supposed to work.
Is a minimally invasive procedure that's done without incisions, and it's very helpful in treating the reflux symptoms and as well as decreasing the amount of side effects that was seen previously with the other types of surgery.
My life started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Dinoco were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on, then everybody's a winner.
As always, for more information on Forest Park Medical Centers or any of the amazing doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
You know, Candace, Forest Park Medical Center, as well as their outstanding physicians, it's all about helping change people's lives. They do an excellent job, and that includes the next doctor who operates right here out of Forest Park Medical Center. It's plastic surgeon Dr. David Azus.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, you know, pulled up the neck and, you know, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, you know, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.
Jennifer has a question for Dr. O. Her question, she's been diagnosed with HPV. What does that mean?
So I see a number of young women in my practice who come to me with an abnormal pap smear showing HPV changes, and this has these patients extremely concerned because they feel like they have been exposed to a, quote, sexually transmitted disease. Part of what I tell my patients is that the HPV virus is endemic in the population, that it's present in most people who've had sexual intercourse. For the majority of these patients, it doesn't create any issues. The body sees it and it clears it or it isolates it, and so it doesn't create a lot of problems. For a small percentage of patients, it can create abnormal pap smears, but even these abnormal pap smears can be very readily handled and treated non-invasively as long as the people keep up with their exams.
In this community that is growing rapidly, very young growing population, sports injuries are just everywhere.
I was at my football practice and I played quarterback. I was throwing the football and I ended up hitting one of the linemen's face masks and my thumb just didn't feel good.
I've come to see Dr. Michelson for my left wrist being broken, tendonitis in my right elbow, and I dislocated my left pinky. So I've been in here quite frequently.
With Brock and Brady, I see them quite frequently. They're great kids, they're competitive. Sometimes it has been an acute injury, broken fingers and thumb, but sometimes it's a overuse situation.
We can come here for anything, even that's just a worry. Sometimes it's just the emotional part where you think you heard it, but when they tell you you didn't, it feels better.
It's very comforting when Dr. Michelson talks directly to you because you know he's trying to help you.
I think it's important to involve the patient in the discussion, to try to help them understand because they're so focused on, I want to play in that game. But in the long term, I try to help them understand how the bone heals and how the body works, the potential problems they can have because of it, and try to carry them through that.
He's just like a friend that knows how your bones work, how your muscles work, and you can just come to him for reassurance. Just really comforting to know someone knows what to do when you don't.
My thumb is 110%. I can move it even a little more now. After all the treatment and what they told me to do, it's perfect.
Don't forget, for more information about Forest Park Medical Centers, as well as the outstanding doctors that operate out of Forest Park Medical Center, head to the website, bestdocsnetwork.com. Now it's time to head to our next doctor. It's Dr. James Davidson.
For the last about 10 years, my life had been slowly getting smaller and smaller. I was unable to walk. My weight had ballooned up during that last year that I was unable to walk, and I had been wanting to look into the weight loss surgery for several years.
Obesity has been told to cause approximately, one article, about 86 diseases, but it also appears to be a risk factor for at least a dozen cancers, particularly some of the female cancers. We know that some of the cancers that are particularly hormonally related, such as breast or endometrial or uterine cancer, is exacerbated because of probably some of the extra hormones that people get from the extra fat cells.
I had many health issues that were going on in my life. I had diabetes, I had high blood pressure, I had what's called metabolic syndrome. My waist was larger around than 6 feet, and I was unable to walk due to osteoarthritis. I had discussed many options for the weight loss surgery with Dr. Davidson in his office, and the gastric bypass turned out to be the best option for me.
So what I like about bariatric surgery is I love to put diseases into remission so that people their atherosclerosis or their hardening of the arteries doesn't progress because they don't have their diabetes and all the inflammatory responses of the body that you get from the metabolic syndrome with being overweight. I also like bariatric surgery because it actually decreases people from getting cancer. Well, my feeling is that weight reduction surgery should even be used as a means to both prevent and improve the prognoses of people that have cancer.
I've really enjoyed my time with Dr. Davidson. He is a straight shooter. He is a very intelligent but a very kind person. He lets you know exactly what you can be expecting, and he is a perfect partner in the weight loss process with you.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
The prevalence of skin cancer is only increasing, especially since we live in Texas, in a southern state. Just the amount of sunlight exposure is greater than, say, if you lived up north. And those who are susceptible can get skin cancers. The most common ones are generally less aggressive. They're called basal cell cancers. You have some more aggressive subtypes such as squamous cell, and then the deadly killer, which is melanoma. Unfortunately, that's more rare.
Back in 2008, I had a little spot that was biopsied and came back positive as basal cell carcinoma. When I met Dr. Hall, he said that he would have to do a skin graft using a piece of tissue from my ear. That surgical procedure worked out really well. Scary at first, but it turned out really well. This year, in May, there was another spot on my nose.
In Dottie's case, she had a skin cancer on the tip of her nose, which is a very challenging location because there's not an easy way to just bring the edges of the defect together without creating a lot of distortion. So you're left with some of the other options. Well, skin graft on her was not a great option because of the depth of it. It was going to heal with a divot, something that had been very noticeable. So really we're left with the more complex option of doing a nasolabial flap, or borrowing tissue from the cheek, leaving it tethered to the cheek, and then attaching it to the nose. Dottie had that procedure done, and that trunk was left there for 4 weeks. She was a great patient. She hung in there. We went to that second stage. We divided it. I did some dermabrasion to kind of sand and smooth the edges of the scars, and she's only a few months out, and it's very hard to even tell that she had anything done.
Dr. Hall is just amazing. He's like an angel. He makes you feel comfortable. He held my hand and he said, "Don't worry, Dottie, you'll look great." And I just had to trust in him. When I think about everything that I've been through, I'm very happy, very happy. I still recognize my nose and I think it looks great. Healthy nose, yes. Cancer-free, yes. I'm very pleased.
That will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area.
Yes, it is. And for more information on Forest Park Medical Center or any of the amazing doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
That is the place to go. Also, you got to have a question or comment for us or Forest Park Medical Center, send us an email at info@bestdocsnetwork.com. So long, everyone. We will see you next week.
Take care.